Okay, great. Thank you so much. We do have another presenter here. We have certainly saved the best for last. I'd like to introduce to you Dr. Josefa Domingos. She is a physiotherapist specializing in Parkinson's with almost 20 years of working exclusively with people with Parkinson's and other movement disorders. She's an educator, clinician, and researcher. Josefa's career is focused on creating and implementing specialized care for people living with Parkinson's, including boxing programs for Parkinson's. Based on her PhD research, she's published several papers, including the boxing programs that she has implemented. She's also trained in boxercise in the UK. Josefa is the National Health Coordinator at the Portuguese Parkinson's Patient Association and co-founder of Young Parkies Portugal. She currently holds several international positions, including being the president of Parkinson's Europe, a member of the scientific committee for the Davis Phinney Foundation, and a member of the wellness group of the Movement Disorder Society. So please welcome Dr. Josefa Domingos.
Thank you. Okay, so the first challenge for you will be if you understand my accent. And from what we learned this morning, I have to be really thinking about the end of my sentences. So how's my accent? Everything okay? Yes? I can't speak very loudly because I come from a country where when you talk loud, you are considered rude. So, yes, so thank you everyone for the invitation, for the foundation, for inviting us. It is a great pleasure to be here with you. It's amazing to see how your culture is really beautiful in terms of emotions and how you, you share this. So it's the empowering in these events is just magnificent. Yeah, and so I bring you a topic which is interesting that we have in these discussions. So how do people make choices? And let me see if you can hear me well. Yes? No. And we selected two of the most, I'd say, available programs, which is, dancing and boxing, to try to bring up a discussion about how do I choose? Should I select one? Should I have both? How do people make choices is really the underlining goal for this talk, and not specifically about what you do. And I want to start off with an interesting, I call it a problem as a health professional. Luckily, I don't work in this country, and so the medical expert panel that was just here won't kill me for highlighting this problem. But it was fascinating to see, if you were attentive, that when we are asked which is the best exercise, there seems to be, from my interpretation of English, two different positions. And I wonder if you noticed that. You had one position which was do what you enjoy and what you like. Who likes this one? Anyone? This is, because we always like, just do what you like, right? You enjoy. And then we have a different position which is, wait a minute, exercise is medicine. So we should think about it as a pill, which makes it a little bit more serious. Do you agree that this might be a little contradictory? Yes? I'm questioning myself because I hear this often. And what's interesting is it's coming from the research community. And there's a reason why we're saying that, so please don't kill me yet, okay? Obviously, we can understand that when we say do what you like, we are comparing to doing nothing compared to doing something is please just do anything, right? Because we are aware of all the exercise behavior and how challenging it is to motivate people to do exercise. So because we are aware of that, we're so desperate to get you to move that we will highlight, please just do something. Just do something. If you really like it, do it. So we get that point. But then at the same time, we are wasting a lot of money, not wasting. We are investing a lot of money and resources into doing research so that we can get better answers. So maybe it does look like more like a pill. What do you think? Or I'm happy with both interpretations because I adapt. As a physiotherapist, that's our mission, right? So if I have two people with Parkinson, that one follows one thought and the other one will follow the other, I will respect both, and we will find a way to benefit the person with both. When I say I think it's a problem, it's because it's coming from the scientific community. So that means that we still are not so sure about what to recommend, because the research is coming out. It's true. They just came out, this new paper that was just published this year, comparing different types of dances. So now different types of exercises. So you had like dance, you had aqua, you had the Lisa Big program that everyone is probably familiar here with. And we came to the conclusion that they all benefit motor symptoms. And when we get a research paper like that was a very strong paper, we say, okay, so of these 10, do what you like. If your goal is to improve your motor symptoms and you have these, then just do what you like. So it's valid. So both are valid, but it does bring on some confusion, I think, among the community. And so that, because there's those limitations, we wanted to bring this talk to you. So if we do, okay, look at this as a pill, again, it makes it more serious, right? If we look at this and like, you know, doctor, I might like the pink pill or the red pill. We tend to think about what would make sense for people to choose or to use, and when to change. When should I change? It's not that easy. I started an exercise program because it's something that is accessible, but I start having issues with Parkinson as it progresses, right? How are you going to change? Have you ever thought about when are you going to change what you're doing? Who do you go to be able to do that change, right? So it's these questions that I want to discuss with you today, and to give you also some guidance on that. So we know that making choices is not easy because there's a lot of things that are underlining the problem, and there's lots of factors that will influence us. So we have all the health factors. We know there's the motor symptom, there's non-motor symptoms that will influence if you wake up in the morning and suddenly your feet are cramping up and you had planned to go exercise that morning, and then suddenly this is happening and you feel sore and you can barely walk. Who wants to go exercise? You have a good excuse not to go. It's not even an excuse, it's something that you're dealing with, right? So all the health issues will obviously weigh a lot in how I am able or not to do the exercise. Then you have personal things. Personal barriers like, do I believe that I can do it? You know, everyone is telling me to exercise. I had recently someone coming to live in Portugal, and she's from New York, and it's so fascinating because she's coming from a culture where you do a lot of exercise, and she said, I'm so irritated with everyone always telling me to exercise. I said, well, that's interesting to hear that from someone that did boxing 5 times a week. So she obviously likes it, but she's getting tired of hearing this exercise, as if she's failing all the time, right? So I think the pressure that we are bringing on regarding this should also be a discussion. So we have different personal factors. Imagine if you have someone that you live with, if you have a care partner that can go with you, there's a different motivation. So, and then we think about, how about environmental issues? If you take 2 hours to get to a gym, you're there for maybe 1.5 hours, 2 hours to go back. What's the probability of you being able to maintain that program for a long time? Right? And so this is a very important one, because we know that unfortunately the disease will challenge you more. And so there is actually research to support the closer it is. We're talking about like 20 minutes. It actually has been calculated in terms of time, that the longer people will be able to maintain their programs. So it's important to choose that also. So what I bring today is just questions that maybe, since the scientific community is having some struggles in being able to answer, can we help give some questions and skills and tools so that the people that are living with it and their families can think about, how can I make these choices? That is the goal that brings me here today. So one of them is, I think this is a key question, you have just been recommended pickleball, you have just been recommended tennis, swimming, and the first thing that we probably think, and you can tell me if you agree, do I believe that I can do it? So imagine I never liked dancing in my life, and now someone's telling me go dance. Like, yeah, no, that's not for me. So do I believe in terms of things that I like to do? Do I believe it because I have the physical capacity to do it? This I think is the first question that pops into your mind. And then of course, will I enjoy it? Because sometimes we do eat vegetables and we don't like it, maybe, soup, right? At least in my country. So I think these are the two main ones that people might think of. And there is a place to think about joy. Enjoyment, happiness are new outcomes that are being used in research studies, which is quite interesting, that we are trying to find out how we can measure enjoyment. This was just a research study that was done based on a survey that was done for a group of 30 people with Parkinson. And they found out that they had these 3 factors that would ultimately influence exercise behavior. So gender, not much that we can do there. If you are married or not, unless we create Love is Blind for Parkinson, I don't think we can do much there either. But we never know, there's new programs coming out. But the enjoyment was the factor that I found interesting in the study. And that more and more we should focus on how can we build programs that give you this joy so that even if you don't like it, you will enjoy it. So can we meet halfway and create new exercise programs that will have those elements? And I think that's the challenge now for the scientific community. And I wanted to give you an example. So I would say different professionals, exercise professionals, physiotherapists, you know, I don't usually defend professions, it's just as long as the professional is competent, I think that's the most important thing. And I wanted to give you examples of something that, let me see, I tend to hear a lot how cycling becomes really boring after a while. So you might really love it outdoors, but if you have one at home, after a while it becomes boring. So you know what, let's think about it. How can I bring an element of joy? How can we create new programs that actually have more elements to it? And this is just an example. Some people might call this dance, I call it engagement. People out there are engaged, as you can see they're having fun. It's movement, upper body, we can have lots of different things that we can work on, that we can say here that we're working on, but it really represents maybe the challenge for the therapists, the professionals, to create exercises that will help you be motivated. So it's not only you, okay, you know, go to exercise and be motivated, we also have a responsibility to create things that also bring you that joy. Another example, so if you go back, I can't explain what these two are doing. It's 2 people with Parkinson. We're in a boxing session, and for a moment they were just playing. And I looked and I started filming, and I was intrigued by this. And it's like, as a health professional, why wouldn't I allow them to have that moment, right? So it's like, no guys, come on, let's go work. So this is what I'm calling like serious interval training. We should have breaks from being so serious in exercise. And so we can do this in a fun way, and that should be the message. It's like for the whole community. We have to make these exercise programs specific, but also fun, because that's the element of keeping you motivated to continue doing exercise. And so I think having a little flexibility for the professionals, you know, just if people are really having fun, I will always prioritize a moment like that than any amplitude-based exercise, because the fun makes people come back. And so as we're creating our lists, we mentioned this one, which is it accessible, right? So it's like, this is an element. So these are 3 different criteria and questions that you can ask yourself on what you are doing at this moment. Okay, does this bring me these elements in terms of helping me keep motivated for exercise? But I want to bring 2 others, and obviously this was touched upon as well now in the panel, which is, whoops, let me just go back here. There seems to be a slide missing, but the question is it effective? And in research, we have the word efficacious, right? So will it have the results, the benefits for you, I think, I would add in, not only if the research says that dance is good and if it's efficacious and that means it's good for your motor symptoms, it's good for, you know, let's be hopeful for the progression of the disease. But what we want is for your specific problem that you're dealing with, is it effective for you? Because you will all be dealing with different problems, right? So if I have balance problems and someone is telling me go swim or do what you want, maybe they're not giving you the best advice. If I have balance problems and we know that there are specific programs that work more on balance, then we are obligated to give you those choices more assertively. So maybe I would say, you know what, boxing has lots of research on balance, dance has lots of research on balance. Maybe you can choose between those two. But that doesn't mean that the other programs won't, we just don't know yet. Right? So keeping in mind this, is it effective for me? And then the other issue that was raised, is it safe as well? Because I might love pickleball, but maybe when I'm doing one little step to the side, that might not be the safest thing for me. So it's just considering the risks as well. Now there is an interesting thing that happened after COVID, that we suddenly had accessible for everyone these exercise programs online, which was quite intriguing. I always used to share how much I hated technology, and because I'm a full-time clinician, I love working with patients, and when suddenly I have a camera and the distance between us, it was horrible. And then I look at the technology and I'm thinking, wait a minute, I don't want to do the same thing that I'm doing in the clinic because nothing will replace that, but can I create something that, you know, you can only do here and we can get with this goal? So what I'm saying by this is like, look at this exercise. I'm just gonna, this is actually a different type of dance that the foundation has been funding a program online that we do.
The most important move, smiling. Say yeah!
And now you might think, oh, this therapist, whoever she is moving too fast. I get that often. I can't do that. But look around and you can see different people doing it in different ways, right? You have someone that is in a wheelchair, you have someone that's decided to be sitting, you have a couple, you have someone that's young onset, someone that's later stages. So it is fascinating to me as a therapist to see so many people different, engaged. And I call this engagement cycle. What is my ultimate goal in these classes? I want people to have a moment of exercise, of raising their heart rate. So if they have perfect, absolutely perfect movements like I'm doing, that doesn't really matter. Because my goal is to provide an exercise, aerobic exercise for the group. And so everyone will do it at their own rhythm. And of course, if you look at it, it intimidates you. Would I be able to do this? Would you enjoy it? Well, apparently the good sample we have, they seem to be enjoying it. So I would highlight, do give it a try. It's a class that's accessible for you, thanks to the foundation. And so it's just building on these questions that we're having. Is this effective? Is this safe for me, right? And let me see if my slides behave. Now, I can imagine that this can become very overwhelming. So, okay, so how do I know if it is effective? How do I know if it is safe? Now, the first thing that I can say is like, you don't have to worry, because I mean, that's why there's professionals around you. That's why there's foundations that you can ask for support in these decision makings. So it's in the ultimate run, there's health professionals that will guide you on what would make more sense. But at the same time, you know, it's just like, let's grab onto an example. And so we are going to grab onto the dance pill and the boxing pill, and we're going to try to think about questions that would make sense for me as a person that living with Parkinson and family. What do I have to reflect on when I try to decide? So we have our two pills, and we're going to be focusing on these two questions. Are they effective for you? Okay, so for whatever you're dealing with, and I'll give some examples in general, and if it's safe. So we come to a new question. What does it mean to be effective? This is from my clinical expertise. This is, the research does not does not give these type of questions, right? I want you to try to think about how do you feel after you do your exercise program, because that will guide you if you may be having too much, too little. If you do an exercise program and you spend in the morning and then you spend the rest of the afternoon in bed recovering, who thinks that's a bad idea? Right? It's like we're stealing half of your day there. Or if somebody really doesn't like to exercise, I'm like, oh no, you know, I've exercised, so now I can spend the whole rest of the day in bed. No, so this is, I think it's a very simple question. It's like, how do you feel after? And we actually did some research behind this in trying to ask people how they would feel after a boxing class. And you can see there's different responses, and that's just the idea I want to give you with this slide, is you can have, ultimately people do a boxing class and they feel fully energized, empowered, invigorated, ready for the day. Or they can have mentally and physically tired, just mentally fatigued, because we know how boxing incorporates a lot of cognition as well. So it's okay to have this interval, and you know that there's different responses and people will be different. And so just figure out where you are and how you can adapt your exercise if this is the case. Let's think of another question. Does it really help you achieve your goals? And this is the example that I was giving. If I want to improve my walking, if I choose an exercise program that actually incorporates training walking, the more likelihood of me improving my walking. Do you all agree? So if I have something like, I'm going to do 1 hour of stretching, and I won't even give examples of that, but 1 hour of Nordic walking, I like to do both, but I want to improve my gait. I will choose maybe the Nordic walking, right? But you can also be like, no, you know what, I'm just very depressed. I'm not in a good mood in terms of maybe in that week. So maybe I'm going to go for the flexibility this week. And it's good I'm using the word flexibility because this is you having also patience with yourself, right? To make these choices. That's why you come to these things, to learn these things, because it's always not losing focus of what is your main goal, because there will be ups and downs, right? And so if there is a moment where you feel that you are more at risk of becoming more sad and depressed, that lasts more than 2-3 days, then maybe it's something, I have to change something quickly before I continue in the same routines, right? So it really depends on the goals. I think when anyone asks me, what is the best exercise, I say, just tell me what your goal is, and then I can guide you better. You do hear a lot in exercise talks about how we have special ingredients that we should be considering when we do exercise or when we select an exercise, and that have, say, somehow scared a lot of people, because it's like 3 days of this, 2 days of this, 3 days of balance and agility, 4 days of that, and where do we live in this? So our quality of life cannot be compromised by us exercising the whole day. There should be a good balance between activity, as we mentioned before, and exercise as well. And we want you to know what we do is like we create activities like boxing and ping pong and walking football, where we try to incorporate these ingredients so that you can get it all together and you can make more sense how you divide your exercise throughout the week. But what is important to also highlight in these talks is that they're not all equal. So here's where the research really helps you, is to understand that we now have strong evidence that aerobic exercise, resistance training, balance training, has very good evidence that will help you improve your Parkinson. We have less evidence on flexibility training. So if you're choosing between one or the other, and now I know that most programs will have a little bit of each, right? So I'm just highlighting here, it's just keep in mind that if you are doing 1 hour of flexibility training versus 1 hour of aerobic training, you will get different results. But it always goes back, depends where you are in that moment and what your goal is, right? So I decided to create these pills for you, and now that everyone, when you hear exercise talks, you always hear about these ingredients, right? And now the next step is for us to think about, so if someone is offering me a dance pill, what is inside this pill? And we can have two ways to fill this up. We can have research evidence. So imagine in dance, we have a lot of research that's already been done. It's one of the activities with most. As you can see, I just pointed out, we're going to be comparing both, and you have 307 studies that I just quickly put on Google to check in a scientific database, compared to 15 of study on boxing, right? So you can see that it's not a fair comparison. That just means the research is not there yet. So we have, in our dance book, we have the aerobic is very, very strong. A lot of strong evidence on this. Mood, so it improves mood as well. And by mood, you can have depression, you can have apathy, you can have, anxiety. There was one missing, yes, if you're feeling anxious as well. And then we have also the effects that it has been shown in terms of balance, of joy. So people seem to really report how much they enjoy it. And I would say agility and the cognitive element is also very well reported now in dance as well, which means if we are learning new routines and movements while we are dancing, we are using a lot of cognition, and then we apply it. So it's the best type of cognition. It's cognition with movement. So if we compare it with what we know about boxing, we have a good, strong aerobic exercise component that has been reported. Joy as well. In all the studies with boxing, people always report how much they enjoy it and have fun. And then some of the research that I did as well as part of my PhD work is showing the benefits that it also has on balance. What we know less, but I would say it's clinical expertise, because if you work long enough in Parkinson, we by the experiences that we have, we get this I wouldn't call it feeling, but it's our clinical expertise, that probably we could all think about how cognition is probably very strong in boxing. It just hasn't been studied yet, but we all know how much learning those sequences can work on our brain, and also the strength, because the things that we work on is not only punching, there's a lot of exercises that go into a boxing class. And then the flexibility will always be less, but it's always at the end of the class, and it depends on the instructor how much time they take to do that, right? So we know they're present, but one might be stronger or not. So imagine we're creating here, our dance pill, what indications will it have? So if you would like to improve your physical capacity, you can take a dance pill. If you want to improve your cognition and your capacity to simultaneously do movement and think at the same time, dance. I can strongly say you can use dance. Okay? When I say scientific community. Then we have also, in terms of if you want to improve your mood, that's also very strong, and balance. So this is like our insert for the dance, right? So we have our pill, and we have to have when to do it and what precautions to have, right? So we have that, and I wanted to obviously reinforce that we are in a time where sharing knowledge is happening everywhere all the time, and so you don't have to only count on the health professional or the doctor telling you something, but you can also look up research studies and see where the research is on the things that you are doing. So keeping in mind that, also thinking about what is the evidence behind whatever I've decided to do. Like walking football is becoming very popular in my country and in Europe. It's an interesting concept, because that means you're not running, you actually have to be stopped while you're passing the ball. So for me, as a therapist, I look at that and it's like, oh, this is awesome, because we've reduced the risk. No one's running behind a ball, which would scare me. But at the same time, we're walking. We are on negotiating busy environments. We're working on gaits, on turning, on competition, on being able to manage taking decisions. It seems so rich to me. We're even working on something called impulsive behavior, which means you're not allowed to run, but you want to run, especially if you were a football player before. So I think this is very interesting if you want to also train that, which we don't have anything for that. So you know, these things start coming up, and now what we need is to have more research on it. So that will probably be the new research study. So you can grab onto things like this, where this was just a research paper that was done, and they compared 10 different exercise interventions. And what you see, it depends on what you compare, right? Unfortunately, in this study, there was no boxing. And when they compared all these different, you've got dance, you've got virtual reality, yoga, swimming, tai chi, and one of the main results, as we're talking about dance pill, guess. The dance offered better advantages than other exercises for motor symptoms regarding Parkinson. That's the Unified Parkinson Disease Rating. I would say those movements that the neurologist asks you to assess how severe your disease is, and also on balance. So this is coming. More and more, the scientific community is trying to compare. Do we have to compare all of them? Probably not, because we can think that maybe dance and boxing are very similar in those ingredients that you see in the pills. So we might want to maybe invest the resources in specific ones, right? Now I want to highlight something very practical. There's probably a difference between me doing something like that I'm calling leisure. So I decide to take a dance class, and in this case, it's actually Irish dancing. And these are 3 ladies with Parkinson that are from Ireland. This is cultural, they really enjoy it. Me coming from another country, I look at this and I say, you know, as a physiotherapist, I would like bigger steps. Yes, there's a very good aerobic component. There's a research study that shows that Irish dancing has benefits. But if we look at something, can we make it better? So as a therapist, I was like, can I make this better? Can I incorporate the other treatment principles that we want, the amplitude of the movement, the speed of the movement? And so, yes, we can create something like that. And you can challenge your therapist tools, because sometimes I recall having this question in a congress. It's like, so who should be teaching these classes, the dance teacher or the physiotherapist? And the person that was answering was a physiotherapist that doesn't like to dance. And so she immediately said, no, the dance teacher. But if you think about it, I'm doing their movements that you probably all recognize from the Lisa Big program and power programs. I just added music and rhythm, right? So it's not rocket science, and any therapist can learn severe things in terms of courses that we take in terms of neurology, and that should never be a barrier. So learning boxing as well for health professionals, I think, is pretty easy, and we just have to, as we're saying, listen, right? Listen to what people are liking and doing. I still continue and will continue until I die. It's like, how can we make this better? People are being recommended, referred to different professionals, and I always question myself, how do they live? If you are going to all the 22 health professionals that have been published, the multidisciplinary team, where do you live? Because you go, of course, maybe here it's like going 6 in 6 months, you go to the whole team, or 3 in 3 months. And so but if you have the spread out, people spend most of the times organizing their consultations than anything else. So maybe we challenge the health community can we create therapies that will help people get a little bit of each of the disciplines, and which goes into more of a transdisciplinary model, which is a little bit present when we talk about dual task training. And in this case, it's just an example of why not incorporate speech exercises and voice exercises while we are also trying to dance and move. And I just want to tell you that it's possible. Sometimes you'll be counting but this was actually organized with the speech therapist, so we are incorporating exercises specific to voice and coordinating it. So I just want to leave a little bit of hope that I hope that the exercise professionals and therapists and doctors can come to a place where we try to give you as much possible as possible. Shall we jump into our boxing pill? I forgot to ask, who does boxing here? Where are my boxes? Yeah? When it was close to the town? Okay. How about my dancers? Where are my dancers? No? Are we all shy? Well, maybe we can close the eyes and then... Yes? Okay, I see. I'm sure it's mixed up in other therapies that you do. So specific indications that we have for boxing, right? At the light of the evidence that we have at this moment, we can say that if you want to improve your physical capacity, boxing is a good choice. If you want to improve balance, it is also a choice. One of the studies that I did was comparing boxing with kickboxing because I had the hope that if we did kickboxing, we might actually improve more balance. And it was interesting results that when I compared both groups, the balance improved the same in both. Now, a lot of things can come from those results. I can question a lot. But what's interesting is like sometimes we do research studies and we figure out that what we thought doesn't work. That doesn't mean it's negative. It adds to our knowledge. So now I can tell someone, if you like kickboxing and you like boxing, it's okay. If you both want to improve balance, they both will work. So that makes me more secure as a professional to be able to prescribe exercise. And in our boxing, for all the boxing lovers, I wouldn't worry that the ingredients are not all there. I just wanted to quickly share with you, there's a lot of research studies we are progressing slowly. Boxing had a particular effect because it became more popular, and it was because it was so popular that people started studying it. And so it has exploded, and almost there's programs almost everywhere, but the evidence is still low. I use the same concept. And there has to be moments for both, because I really like to listen when people are giving us feedback. And I heard some patients say, "Oh, now you're going to clinify boxing," you know. And they were like sad because here we're doing something fun, we really enjoy this, and now here comes the clinicians and they're going to make this all serious. And we should hear that, right? Because do not take away the fun. And how can we do that? Either by creating exercises that are fun, or just giving people time and moments like these. So just having moments where maybe you don't have a goal, you're just making people laugh and you're just interacting with the person, right? I do a lot of individual therapy and I do a lot of group therapy as well. So to try to understand what the best combination is. This was actually in a boxing club in Sweden where we implemented a program. And it was interesting to see how we go to try to implement a program inside a club, a boxing club with boxing instructors. And if they would be able to provide that program to the people safe. And the results were very positive. It's still a growing program in Sweden. It's spread a lot. Now, if you ask me, do you think that a clinician maybe would do it better? I can honestly say the expertise behind the professional will help identify problems quickly, and I'll come to that in a second. Like, for example, maybe I can create a station where I know someone is dealing with sitting and standing problems, and this is a gentleman that was falling often because he was home alone, and he had to get up from the couch very quickly to go answer the phone or to go answer the door. And so relating to falls and quick decision making, we created this exercise for him. Now, what is he doing? I'm just using the boxing as a tool to motivate him to sit and stand endlessly, which obviously there's a limit, right? There's a dose. But so what I'm doing, I'm just creating that as a distracting, and he's actually doing another cognitive task associated to this. So how can I create different ways of motivating the person to train the same thing? Instead of him coming 3 times a week and me just training sitting and standing, I'm just using the boxing as a tool to motivate. How about safety? For me, safety is the expertise. Because I can adapt anything, the exercises online, in the swimming pool, as long as I can predict what's going to happen. So the knowledge that I have about Parkinson will help me keep you safe. So I think this is, if you keep this in the back of your head, it's like, who am I working with and what's the expertise? And I think at this moment, most health professionals that are working with Parkinson, just working with Parkinson is a source of expertise. So the more people with Parkinson they treat, the more expert they become. So that's okay. And then there's so many educational programs happening at this moment. So I don't think that this could be a real issue, but let me give you an example. So social media is awesome for this. We can go get nice examples. And this was published in a group. And I just want to highlight a sentence here. So I was with my instructor this week, and she kept saying, your left arm is being lazy. She was surprised that that's a Parkinson's symptom. We know that Parkinson is asymmetrical. We know there's one side that's more affected than the other. It will always be weaker. So if this, imagine if this is happening in a boxing, I'll say exercise. What we want from exercise is always reinforce your most affected side. It's a principle of treatment. I will never do 10 of these and 10 of these. I'll do 20 of these and maybe 5 of these, and maybe I'll do one and this and alternate, right? Because if you don't use it, you lose it, right? It's a principle that we have. So it's important for us to, if you feel that this is happening, this is a good situation where you can be proactive in teaching the therapists and the exercise professionals. And a good therapist will always hear you and welcome that knowledge. If they don't, you should change. That's a criteria for change, because you want to grow together in terms of that knowledge. And I wouldn't be, if somebody teaches me something, I try to incorporate it. So what's the relevance of this? The relevance is when we think about safety and harm and do no harm, by reinforcing the negative movements, ultimately, even though we don't have research to back that up, ultimately it's not so specific. It is harming you in the long term, right? And I'm not even discussing how the person might feel in terms of frustration because she's just being called out on something that she can't really do. The most important thing about the expertise is if you have someone in front of you that can identify the fluctuations of the disease and in the moments, and we know that there's on-off phenomena, but we know that the disease is progressing slowly. And so the more I work with someone, just them coming in the room, the way they're walking in, I can identify they're having a bad day. And if you are always doing the same thing, so you have your boxing class, you have 20 rounds that you do of something, and when you go on a bad day, you won't be able to do 20 rounds. You will feel, how will you feel after? Frustrated, right? So if I can identify before, okay, probably I can, if I have a moment to speak with the person, like, did you sleep well? Is there something new happening? Did you change medication? But maybe in a group setting, that's very challenging for the therapist, so they might not be able to. That's why reading body language for the therapist is very important. I can, you know what, today we're going to do something different. So I don't have to call out anyone, I just change everything. Just today I've decided you're only going to do 10 each one, and then we're going to do this exercise. So, and we're going to do this exercise on the floor, because I know the person's not well, so I'm going to adapt the exercise. If you have someone that is attentive to this and knows and can identify, then they can change that. So I think it's possible. I hope to give you hope that the therapists can do more. I know we can do more. And before I continue, let me give you another example. It's like that I was saying, you wake up in the morning and your feet are curled up, that I said earlier, and you go into the gym and you're struggling. And if you tell this to someone that works with people with Parkinson, they will give you one answer. If it's someone that doesn't have expertise in Parkinson, they might say, you know what, let's go do some stretching today. Now, this is a problem that is probably related to the medication, right? It's a phenomenon that we know that might happen, and so if you're working with someone that has expertise in the area, they might say, you know what, tomorrow, why don't you try to take the medication just a little bit earlier in bed before that happens. But obviously, contact your neurologist is always the primary response. But it's just, sometimes it's just recognizing that is a phenomena that can happen and that is treatable by just adjusting the medication, and it doesn't respond so well to stretching. So if I insist with the person that they should be doing stretching, they won't identify this as a major issue to go and treat it and to consult their neurologist to be able to handle the problem better. Am I passing the message? So it's like identifying problems quickly so that you can act upon them and obviously get the best response. Okay, so pushing forward, these were just examples that I wanted to highlight, that even though we don't have research that is identifying severe adverse events and injuries that people are having, this is not, unfortunately, it's underreported in studies, so we don't really know. We just hear that there's no adverse events in any research study and everything's fluffy and beautiful, but we do know that people are falling in these programs. But injuries and risks and safety is not only about falls, right? There's also the frustration of maybe going to a place where you see people they have more difficulties in ever wanting to come back, as you heard before, right? Those are also risks that might happen. And I'm coming down to also recognizing these were the 3 questions that I placed for both, right? If you have a pill in front of you, you think of these. And obviously the evidence regarding the boxing, as I said, is very limited. And what you have is different applications of how you apply it. And I think so in order for us to keep people safe, it really depends on who's applying it, what are they applying, how they're using it, how they can adapt it. And that's why it's summarized in the word expertise. So you have different formats. Maybe you'll recognize better the one on the left here. This is taken from the internet. It's a Rocksteady method protocol. So it's, I think commonly people are working in their stations. It's one way to go, especially if you have such big groups. In Portugal, I tend to prefer on this option, which is smaller groups. And in groups that I can create exercises that make people interact with each other. So I think it's a socialization component of the exercises that is the glue and that helps people feel more empowered. And you might feel, oh my goodness, they're doing contact boxing, they're touching, okay? It's nothing. They have a sequence, they have a cognitive sequence, and each one of them has a separate letter. So I'm saying A and B come in, B goes out, A comes in, C goes in. Do you see? So it is cognitively challenging what they're doing. And you will see that obviously when the lady goes forward, I know she has balance issues, so I go with her as well. So I'm able in a little setting, keep everyone safe. So just to finalize, hopefully my key messages is that coming back to our initial question, we do know at this moment that boxing and dance are 2 very interesting programs that people can sustain for a long time. So there's the studies that have been shown is that people can do these programs ongoing and still keep motivated. We don't know that about maybe ping pong or pickleball or the other sports and other programs that are coming out. We don't know that. How long do people endure before they need a change? And we know variety is very important as well. But these 2 at least have this. It's highly motivating. People really report how much they like it. And then it's sustainable. And then another key message has been regarding the professional expertise and how we can help that. And that is part of one of the programs that brings John and I here today. This year we are going to do a boxing program for tomorrow here for the foundation as well. So hopefully we can bring these ideas closer as well. And then as being proactive in your care is being able to keep updated on things that are coming out. And so you are the resilient ones that stayed behind. Now everyone else has ran away, okay? So just keeping updated, I think, is one way to empower yourself to be able to make these choices better. And then obviously there are, so even in moments where you might not be able to get out of the house because of the weather, hopefully because of not COVID again, but because of travel issues, because maybe the person that drives you is not there, that we do have online resources at this moment, so there's no reason for us not to have access to that. And hopefully I have raised some questions that will help guide you in the decisions that you've made. And it was useful. Thank you.
Thank you, Josefa.